The U.S. is now rerouting all flights coming from Uganda to 5 specific airports in order to do enhanced Ebola screenings on the passengers as they arrive. The reason being, there is currently a growing outbreak in Uganda, and the U.S. is now making this move as a precaution against the spread of the disease. Currently, there are no cases of Ebola in the United States to report. Joining me right now, so, of course, this brings a lot of questions with it. CNN medical correspondent Dr. Tara Narula and also Dr. Craig Spencer. He's an associate professor of public health at Brown University. And you'll probably recall in 2014, he gained worldwide attention as New York City's first Ebola patient. Thanks, guys, for being here. Dr. Narula, first, what exactly is the Biden administration? What is the plan here? What are they doing here?
Yeah, Kate, so this has historical precedent. We did this back in 2014 through 2016 with the previous Ebola outbreak. And the idea is really to identify passengers quickly in terms of their exposure or any symptoms, get them treated with medical care if they need it, also get their contact information so you can alert local public health authorities for contact tracing purposes and give them public health information about what to report and what to look for. Essentially, we know that in general, about 145 passengers arrive on a daily basis from Uganda, over 60% through these 5 airports, and there are no direct flights. And so when a passenger has come in, they've been in Uganda for the previous 21 days, that's the incubation period, so anyone who's been there over a 21-day period is going to get a temperature check, a symptom check, a health questionnaire, and then their information is going to be collected. And this is part of kind of that layered strategy approach. Also, the CDC issued an alert to doctors as well to basically look for travel histories in anyone who has any symptoms that may be indicative of Ebola.
To keep an eye out. It might not be the first thing you're asking about, but this is something to keep an eye out for as your patients come in. Dr. Spencer, for more context, you contracted Ebola while in West Africa treating patients back in 2014. This type of the virus is different from what you were dealing with. What do we know about this Ebola outbreak in Uganda?
What we know so far is that there's been over 60 confirmed and probable cases, and there's been around 30 deaths. More concerningly, there's been also 10 cases in healthcare workers and 4 deaths in healthcare workers. That's particularly bad because we know that a lot of healthcare workers are highly exposed just in the course of taking care of patients, and many don't have adequate personal protective equipment to keep themselves safe. We know that there are already 4 districts reporting cases. As of yet, there haven't been any reported cases in Kampala, the capital. There have been alerts in surrounding countries, but it's important to recognize that testing infrastructure, both in Uganda and especially in surrounding countries, for things like Ebola is pretty weak. And although this species of the virus, Ebola Sudan, is different than the Ebola Zaire species that caused the big outbreak in West Africa and most of the big outbreaks in the past, the symptoms are the exact same. The problem is the treatments we have for Ebola Zaire, the vaccines we have for Ebola Zaire, that we got through painstaking work in the field with communities over the past few decades, unfortunately, they don't seem to work against this species, Ebola Sudan, causing the outbreak in Uganda now.
Real quick, Dr. Spencer, one thing you've talked about since 2014 especially is the need for balance, right? To respond to a public health concern, to inform people but not scare people or cause hysteria. Ebola is scary, of course. How are they going to be able to strike that balance?
Well, what I think is important for everyone to recognize right now that your risk of getting or dying Ebola right now in the U.S. is lower than your risk of getting struck by lightning or attacked by a shark. It's important that we're aware of it, of course, but the response should not be just to insulate ourselves. I was disappointed to see the CDC announcement not accompanied by an announcement of what we are doing as the U.S. government on behalf of Ugandans to increase infrastructure, to increase support. I think those two things should have gone together because in a sense, we're repeating the mistakes we did and made in 2014 when we made it sound like it's us against the world. We're going to protect ourselves and let the rest of the world fend for themselves. We need to fight this fire at its source. That's the safest way to keep us protected, but also to end the outbreak as quick as possible in Uganda.
Dr. Narula, really quick, talk to me about what should people know as we end this today?
Yeah, well, I think the important thing to know is exactly what Craig said. I mean, right now the risk right here in America is low. It's important to understand this is also not transmitted in an airborne fashion as we're used to with COVID. It's transmitted with fluids and bodily contact with those fluids. And also it's
And that's what we all need to know about this. It's great to see you, Dr. Spencer. It's great to see you. Thank you all so much for being